Welcome, my incoming sterile processor. Thank you for tuning in today. Today, I'm going to be walking you through introducing you the sterile processing department. So let's get straight into the video. So today we are going to be talking about decontamination, cleaning, personal protective equipment, sterilization, instrument for use, case cut system, case cut, sterile processing workflow, and sterile storage. So we're going to be going through all these places in the department. Over here we have the way in which we process things. We process things from SWOR era, after the SWOR era, to the clean era, after the clean era, to the sterile storage era. This is how we process things from decontamination to assembly and to the sterile storage era. Before we enter into our decontamination era, we have to follow the standard precaution rules. So before we enter into decontamination, we have to be fully dressed. The reason why we are fully dressed is because we want to protect ourselves from any microorganism, from any fluid or for any fluid that we may get in contact with. So that's why we dress from head to toes. We protect ourselves very well. Next is the decontamination department. So the decontamination department is where we do all the cleaning process. We'll make sure we attend to every instrument individually. We have the process of which we can clean our instruments. So we have like three sinks. The first sink is for spraying the instrument down with very cold water, and then the middle sink we fill it out with a detergent, and there where we do our brushing on the water, and the detergent help to break down every particles that we don't see with our naked eyes. And the third sink we just rinse it. Next, we have our assembly era. So after we're done cleaning our instrument in the decontamination era, the next step is our assembly era. Our assembly era is the clean era that we do all our inspection to make sure decontamination process did not mix anything. So we check for the functioning of the instrument, we make sure they are functioning properly. If not, we send it out for repair, and we make sure to check every corners, every size of the instrument. If we see anything that is dirty, that have rust or anything, we take it back to decontamination for reprocess. And also at the clean era, we follow the list in the IFU of how the instruments need to be processed. So for example, if we have a needle holder that need to be lubricated, we will spray some lubricant on it to release the tightness of that instrument. Next is our sterilization era. So after we're done with the cleaning or with the cleaning, the inspection, next thing we have to do, we have to send it through the sterilizer. And what is the responsibility of the sterilizer? The sterilizer there to make sure every microorganism that is on the instrument is totally dead. There are no 1% chance for them survive. So we put the instrument to the sterilizer, and the sterilizer means it kill all the bacteria, especially the spores, which is very hard to kill. And before we sterilize any instrument, we have to follow the manufacturer for use the instruction, because some instrument go on a different kind of temperature. So we, for example, airplane, we have to make sure it on the right cycle and on the right temperature. So that's why we follow the manufacturer IFV, which is very important because if I run my instrument on different cycle, that instrument cannot go on, or either it can damage the instrument or that instrument will actually not be sterilized and it can cause infection for our patient. So after we sterilize our instrument, we bring it to the sterile storage area. So the sterile storage area is where we keep all our sterile instruments. Is where SPD staff go to pick their instrument for all the cases, for every different patient that come in to the department. So the instrument just sit there and wait for us to come pick it and send it to the OR. So this is the example of the case card. So the case card have all the instrument the doctor needed for that surgery. So we're going to pick all the instrument the doctor needed for that surgery from the sterile storage area. If we need instruments, if we need supply, we go to the supply department area and pick supplies for the procedure. Next over here, the case card system. The case card system usually sometimes some doctor use specific instruments. So for that doctor, some they come like once in a month of once in a while, and then they have that specific instrument that they want to use. So we have it in the storage. If Dr. John only use scorpion instruments, that's the instrument we will get saved for him. So some of them use specific instrument. So I just want to tell you guys, thank you for tuning in today. Remember to not forget to subscribe. Over here we talk everything about sterile processing. I will go over every chapter that is very important for the examination. Today is just the introduction. So see you in my next video. Do not forget to subscribe, hit the like button, and make sure put your notification bell on. Love you always. Remember, keep on practicing. More practice question, more consistency, more habits, and it's going to give you the result that you deserve. Bye bye. Have a very nice day. Love you guys.